Attention deficit hyperactivity disorder is a chronic condition that affects millions of children and often persists into adulthood. And it typically involves medications and behavioral interventions. But Dr. Alan Miner of the Health Quest Chiropractic Team is offering promising results without the drugs. Good morning.
Good morning, Nikki.
Good to have you back.
Good to be here.
And you know, we are seeing more ADHD diagnoses these days. Why is that?
Yeah, a really scary stat that we're hearing about today is in the last decade, Ritalin prescription, which is a stimulant medication that's typically used when somebody's diagnosed with ADHD, has increased 5 times in the last decade, and 90% of that is used right here in the United States. And the big concern we have is, for a child in particular that's ever looking towards a military career, they typically do not allow somebody into the U.S. military who's been on Ritalin. So if there are any other options possible, we want to use all of those to the best of our ability. Well,
do children's learning styles play a factor in this diagnosis?
Definitely. And a lot of times children have other things going on.
Okay.
Unfortunately, there is an incentive for many of the schools around the country. The higher number of children who've been diagnosed with a disability, a lot of times there's more funding for that school available. And so if a child has, sometimes maybe a child learns visually and the teacher teaches in a different style, that can cause problems. Other times there's things like dyslexia that can contribute. So the diagnosis can oftentimes get very muddled if we're not careful.
Well, how is ADHD diagnosed then?
Well, the traditional medical route today is through a questionnaire.
Okay.
And so unfortunately it's a very simple questionnaire. It's very generic.
Is it? Okay.
And so true ADHD has a lot of different neurological components to it.
Okay.
Things like tics and tremors that these children suffer from.
Wow.
Also sensitivity to light, to sound, and then the big one is postural issues, balance problems. So somebody who truly has ADHD, oftentimes the category of diagnosis, a lot of kids who maybe have other issues going on are getting lumped into that category.
See, I would have never thought, I mean, when I think of ADHD, I would think maybe hyper, I would think maybe just can't keep their attention. I mean, it's interesting that there's so many other things. So what can parents actually do to mitigate the ADHD symptoms?
Well, there's a handful of things. First is there's dietary changes and things that children can focus on to help. The big thing is your brain is what's being involved with ADHD. So anything that creates a chemical reaction, we can help to clean out. And there's a lot of things in our world today.
Well, what about Halloween candy? I mean, all that chocolate, right?
Definitely.
Sugar.
Creates big changes in a child's brain, that sugar, which for somebody who's suffering from ADHD kind of short circuits things. So that's the big category is nutritional things, dyes in foods, chemicals, pesticides, anything that turns into sugar, so white substances, flour, sugar, bread, wheat, gluten, all of those things.
All the things we love.
There's a big list, definitely.
It is. Well, there's actually a chiropractic approach, though, to ADHD, which I don't think anybody realizes. So can you talk about that? Yeah,
we are so passionate about children, and the results we see in chiropractic are phenomenal.
Really?
It's not uncommon to see a child increase within the first 3 months of treatment a couple of grade levels, and then we see that continue on as their brain's developing. And here's why. Because chiropractic care focuses on those postural changes. You see, what develops a child's brain is postural input, the nervous system giving input to the brain that helps develop the hemispheres. And so if there's a postural imbalance, you're getting imbalances into how the brain can develop, and that's what ADHD is. So it's one of the things we do over at Health Quest is we put a lot of emphasis into mapping out the musculature of these children's spines to make sure they're getting that normal input. And if there's imbalances, by balancing that out, we can really address a neurological deficiency that these children have, and all of a sudden we see things like focus, their ability to perform in school improve.
And this is starting at a young age. You can get them on the right track early on, which is so important.
As early as there's a common link to how a child's birthed through C-sections, forceps, vacuum births. People don't realize how much tension is placed, and that can start the postural problems from an early age. So
well, you also incorporate some nutritional changes, and that really helps too, so that they don't have to use the drugs. So tell us some of the nutritional changes.
Yeah, and so some of those are what we touched on. Anything that is a stimulant we want to avoid. So and particularly things like sugar turn into stimulants that can really short-circuit these children's brain. Another thing is additives. The big no-no today is something called an excitotoxin.
What's that?
It's MSGs, maybe the most popular one.
You find that a lot in a lot of the Chinese restaurants, right?
It used to be, but actually, if you read through most packaged foods, a lot of potato chips, things like that.
With MSG?
Yeah, and so anything like that that alters brain chemistry, we want to get out of that child's diet, and we specialize in helping these children and these parents to identify the dietary problems, give them practical solutions, because children are kind of picky.
You think? Yeah. Oh, just a little bit. You know a little something about that. You have some children of your own. Let's tell our viewers how they can reach you so they can come on in.
Definitely. Well, there's a couple ways. We encourage everybody to contact our website, which is over at newmexicochiro.com.
Okay.
The phone number is 343-6120, and something that's not on the screen that we're doing today for 7 families who have children who are dealing with these ADHD issues.
Yes.
We will do our entire new patient evaluation, our child evaluation, for only $99. It's typically $250. So we'd encourage anybody who's listening who just doesn't want to go the Ritalin drug route, who's looking, come on in and get some other options.
Just call and say they saw you on the show?
Yeah, definitely. And unfortunately, my team is working this morning, so they probably can't answer the phone a lot. Just leave a message, and they'll get back to you here in the next couple minutes.
Fantastic. Thank you, Dr. Martin. Love having you, as always. And you want to stick around because it's getting creepy in our Builder Source kitchen. My voice is pretty creepy, too. Liquid Muse mixing up some spooky cocktails. Don't go away.